Okay, so how does this work? What happens? Well, what you have happening here is you have this air pressure mat. It's what's called a non-porous material, meaning air can't get through it or under it. And so when you place it on the stool, it sort of pushes all the air out and it kind of creates a seal, what you might call a suction cup. I'm sure you've used those at home. And so what happens is when I put that air pressure mat on there, but there's a tiny little bit of air in there. When I lift up, however, it creates an area of low pressure. The air in there is trying to expand. The volume has slightly increased, but there's not more mass. So the density is decreased and we have an area of low pressure. So we have low air pressure inside, meaning that the air in this room and all around is greater. So the air pressure pushing down on the stool is greater, and the air pressure pushing up on the stool then is greater than the air pressure between it. Now, if I were to take a little corner and let that go, the air then is able to get in there. When it was sealed, the air could not get in there to increase the air pressure, and so the higher pressure outside was pushing these two together. And yes, we've talked about the air column. The air column is pushing down on all things, but the stool doesn't get crushed because there's air at the bottom of the air column pushing up on the air above. So in this case, we're working with air pressure and we know gravity is at play. When I pick this up, gravity you would expect to pull this down, but because the air pressure is so much less inside, air pressure is the force that wins and is able to push these two together. When I allow some air to get in, that air does get in and it's able to push in all directions, separating them. Gravity pulls the stool back down.